Now, I would like to invite Professor Aditya Kapoor, who is the head of Department Cardiology, SGPGI, Lucknow. Welcome, sir.
Good afternoon, everybody. Thank you. So अभी मैं रंजन जी से बात कर रहा था. He was absolutely, he hit the nail on the head when he said we need to have more collaborative network, platforms like this. And this is echoed in the words of Dr. Mahler, who was the head of the WHO some years ago. He said the exact same thing. We have to encourage partnerships between hospitals. We have to build on each other's unique strengths. And we actually need to dissolve the walls which are separating one hospital from another. There are traditional boundaries which prevent knowledge sharing, prevent networking. And sometimes these boundaries actually isolate us from the very people we exist for, that is our patients. So wo bada zaruri hai, we need to break down these traditional barriers. And I think we in the healthcare world are uniquely positioned to make changes happen. I'm so glad that Dr. Rakesh Kapoor sir is also here because the SGPGI can offer a lot, but I'll be briefly focusing on only three things. और ये सारी चीजें सर ने भी mentor करी हैं. He has nurtured many of these things at SGPGI. One is a robust supply chain system for patient comfort, which previous speakers also mentioned. Impeccable patient records, which sir I think touched upon, and capacity building and telemedicine to integrate with regional networks. So three things I'll briefly focus. But whoever wishes to foresee a future change must delve into the history as well. So briefly, I'll give you a historical flavor. Traditional hospital care is not a recent thing. Prehistoric cave hospitals existed thousands of years ago. अगर आप देखें तो ग्रीस में टेम्पल्स में डिस्पेंसरीज थी, मिलिट्री हॉस्पिटल रोम में थी. इंडिया में किंग अशोका वाज द फर्स्ट वन हु सॉर्ट ऑफ ऑर्गेनाइज्ड सम डिस्पेंसरीज. And it is fascinating to read the history. They were actually called Punyashalas. So note the word Punya. They were managed by a medical doctor and a surgical doctor, and history chronicles it. They say that these places were built by benevolent and educated people who used to help the poor and the infirm. And there was a bedside delivery of food and medicine. So bedside delivery of medicine, which was a key. And the Lord Venkateshwara temple in the south actually has records of these Ayurvedic and herbal medicines which are part of the hospital inventory. There are written records of it. So it is fascinating to see that, and somewhere we have lost connect with that. So that is the first tenet which SGPGI can offer: hospital revolving fund, which is a specialized chain supply system conceptualized nearly 30 years ago. Because tab hamare bhi patients, they used to get most of their stuff from outside. There was the issue of timely availability, cost, not an assured quality, and people with old attendants and female attendants. रात का जो टाइम था उस समय पेशेंट्स ला नहीं पाते थे. And Dr. Kapoor has been chairman of the HRF, and as I said, he nurtured it over many years. We learned a lot from the HRF, and we are continuing to learn. It was devised as an in-house system to ensure timely supply 24/7 at affordable cost. And the entire spectrum of hospital care was covered. Mission was supply all. और जैसा चीफ साहब ने भी कहा, the purpose was to give from one needle to robotic accessories to the patients at all times. And we follow a unique spoke and hub model. एक central store है which is linked to nearly 200 stores, so that the HRF footprint covers the entire spectrum of the hospital. The patients usually don't have to run outside or anywhere. System is unique, again devised by our senior professors and mentors, and we are reaping the benefit of it. Once the doctor prescribes the drugs, it is raised on the hospital information system. This is the outline. These hospital guys goes to the store with the prescription. The storekeeper verifies the drug, and OT may be 24/7 ये चलता है. There's a bedside delivery of drugs. So this is, what Dr. Kapoor sir and previous people who mentored and brought this HRF. There is a bedside delivery of drug. ICU में जो patients हैं, तो जैसा मैं बता रहा था रंजन साहब कि जैसे patients को bedside delivery मिलेगा, and people with female attendants, people with sick babies in the ICU, they actually get a bedside delivery. And once this is delivered, the patient actually signs off a receipt so that it is validated कि जो उसको prescribe हुआ वही मिल रहा है. So it's a bedside delivery of drugs, which is a thing which should be emulated by other hospitals. और कोविड टाइम में जब हम लोगों ने पीपी दिया, जब पीपी हम लोगों ने कोविड टाइम में दिया, we worked very hard on giving a good PPE to the healthcare workers and produce a paper out of it. and the tender inputs were sought by UP Medical Supply Corporation because our PPE kits were wonderful. PhD theses have been produced on the working of HRF, and it has been documented in literature that this model should be emulated by other prestigious organizations. क्योंकि इस पे मैं सर आपकी अटेंशन चाहूँगा कि ट्रांसपेरेंट वेंडर सिलेक्शन सिस्टम है, rates are much cheaper and assured quality because the doctors themselves are involved in technical evaluation of the products. जब कपूर साहब भी वहाँ पे थे तो डॉक्टर्स की एक कमेटी बनती थी which actually evaluated the products, so the guys, the patients will get affordable drugs at good quality. A huge inventory which is on the computer HIS system so that consumption patterns are predicted. We don't overorder. There is a downward rate revision clause built in the tender rate contract so that price is revised anywhere in the country. It is passed on to the patient. High cost items are procured on a consignment basis so that there is zero investment of working capital. So, this is the futuristic thing which was launched 30 years ago. और इस वजह से है कि this has now become a role model. Mission supply is being emulated by various hospitals, and we got requests from AIMS Delhi, ILBS Delhi to get this model in place, and we are glad to know that it has been replicated to some extent in various hospitals. So that is the one tenet of hospital care which people should emulate. SGPG is willing to share that knowledge. Electronic hospital record, जो सर ने भी अभी बताया. So again, a brief flavor of history. The history of medical records is 1,000 years old. ये एबरस पैपरस है which is chronicling Egyptian medical records from nearly thousands of years ago. और गुप्ता era का अगर आप देखेंगे Indian medical records were also fantastic. But again, have we lost connect? तो हमारा HIS system जैसा सर ने भी अभी एम्स में बताया, we were the first, one of the first government hospitals to get a hospital information system, briefly said, told as HIS, integrated software solution to improve the management of healthcare services within a hospital, launched in 1999 and again improving over the years. So it's a central hub for all related activities. Data retrieval is possible on a mouse click. All inpatients admission, outpatient appointments, lab services, OTs, ICUs are linked to the HIS. अगर आप ये देखिए लैब जैसे है तो लैब की रिपोर्ट्स आर अवेलेबल ऑनलाइन एंड दे आर फ्लैग्ड ऑफ बाय रेड. द एबनॉर्मल रिपोर्ट्स आर फ्लैग्ड ऑफ बाय रेड, so you have the clinician as a visual cue कि something is amiss. X-rays, radiology images, clinician can view on-site and off-site moving images, which is called the PACS or the Picture Archival and Communication System. Patient का एक अलग portal है, so patients will get their own IDs and password. They can access their accounts, they can access their own records, so it's very patient transparent. एक PD facility है, patient employers deposit facility, which will employ, which allows the employers, donors, helping agencies to transfer directly money into the patient's account. And it is linked to all government funding schemes. We have MOUs with various agencies, so it's a sort of a seamless patient management. Once the guy is admitted and he has all these schemes, he doesn't have to run around too much. So it's a patient-friendly portal. Again, lot of research, theses, publications have been produced on HIS as well. So it's an iconic feature of SGPGI MS, which is again emulatable, again followable, comprehensive data records, good data retrieval, patient transparent, highly secure. And again, it has been emulated by many institutes and very pleasingly 22 new medical colleges of the UP government. Last thing quickly, I'll say, how can we make a change happen? There's been a lot of talk about off-site capacity building and telemedicine. So this is again an extremely important thing. We recently signed a MOU with the Power Grid Corporation Tele ICU project, which again was briefly touched upon in the previous talk as well. So this is going to be a futuristic thing, collaborative critical care with peripheral ICU centers, because sometimes the care over there, they might want to have some knowledge sharing rather than transfer a sick patient. There's going to be a tele ICU central command center, pulmonary medicine and emergency medicine. We have a hub at SGPGI linked to spoke hospitals across the state, Gorakhpur, Meerut, Jhansi, Prayagraj, Kanpur and Agra. And it will be a 24/7 real-time audio-visual data transfer between the central cockpit, which is SGPGI, and the peripheral remote hospitals. And entire data screens are going to be shared, including the patient's bedside monitors, hemodynamic parameters, ECGs, blood pressure, progress charts, biochemistry reports, so that consultants at SGPGI can pass on advice or whatever the help is needed to guys in the remote center. So I'll conclude by saying that collaborative partnership in patient care is the key today. We should realize that local health systems are the very heart and soul of healthcare. Although we are sitting in the tertiary care, but again, the local healthcare systems have to be nurtured and mentored. We need more knowledge sharing platforms like this so that joint responsibility across the tiers of healthcare can be embraced. And decision makers like us and like sir should encourage creation of a health ecosystem wherein other hospitals, medical industry and patients, they are equal partners because their feedback is as important as our clinical skill and acumen. And again, I would like to say, Dr. Kapoor sir is there. Government and private, इसमें कोई ऐसा नहीं है कि everybody is separate. Government and private sectors both should come together to serve together for achievable and good public health goals. So I will conclude by saying, the time has come to change the paradigm from volume to value. We should not be chasing numbers, we should be chasing quality. And as Gandhiji mentioned, a customer or a patient is a very important visitor to our premise in the hospital. He is not dependent on us, we are dependent on him. So we are not doing him or her a favor by serving him. He is actually giving us an opportunity to do so. So we should avail of that opportunity and try to serve our patients to the best of our abilities. Thank you. Thank you so much.
Thank you, Aditya sir, for sharing the insights on the initiatives being taken by SGPGI Lucknow. Before we move ahead for the last session of the day, I would like to call on stage Ranjan sir to present speaker mementos to the esteemed speakers. Dr. Mohit, Joint Director, ABDM UP. Dr. Anuradha Jain, Senior Advisor, Health System Strengthening USAID. Varsha Shrivastava, Assistant Director, NABH. Dr. Ajay Singh, Director, AIMS, Raipur and Bhopal. Dr. Sushil Meher, CIO, AIMS, Delhi. Dr. Sushil Meher, CIO, AIMS, Delhi. Professor Aditya Kapoor, Head of Department Cardiology, S.G.P.G.I, Lucknow. Can I request for a group photographs of all the speakers on the stage with Ranjan sir?